Now they put barricades in front of emergency. Why? Because patients used to be close. Alright guys. So let's enter into another gist. So let me talk about my experience working as a medical doctor in Nigeria. So we'll talk about first of all the morning routine, the morning shift into the night shift. Then we'll talk about working in the emergency unit, then working in the surgical unit. Alright, so let's talk about the morning routines and the night shift. So for morning routines, most times, especially if you live in the hospital, for example, you have to be there, like present at work as early as 7 a.m. Because most times that's where the ward round will start. And there are some consultants that want to start their ward round sometimes as early as 6:30 a.m. So you have to really align with the consultant or with maybe a senior medical doctor or medical officer to find out, especially those early morning rounds, to find out when they want to start their round. But typically on average, it usually starts around 7 a.m. So 7 a.m., we are all gathered, the junior doctors, senior doctors, different cadres, and then if it's a consultant round for that particular day, just prepare yourself that it's going to run for hours. I mean 4 hours minimum or maximum maybe 5, sometimes even 6 hours. I have been in ward round that lasted for 6 hours. Yes. So we start 7 a.m. We start from, so it depends also on the units. So either pediatrics or surgery, whatever unit, irrespective of that. So we start, and depending on the ward, you can start from maybe the male ward into the female ward, or the female ward into the male ward. And we come in, we go from patient bed to patient bed. So I'm sure most people that have been in the hospital have been patients or relatives of patients. I'm sure most times you'll be wondering why we are always in lots like that, or we come in that number. The idea of ward round is for especially the junior doctors, that the house officers or the junior medical officers to actually learn. That's why they tend to ask questions. Gonna have to ask you questions based on that. And then you have to have an idea of every patient, especially those junior doctors. We have to have an idea of every patient in that ward. Male, female. You have to have an idea. Even though you're going to be reading the case notes, you also have to have an idea because you're overseeing the patient. Especially if you did night shifts a day before. But in general, you have to have an idea. So we go from bed to bed. We go through the case notes. We ask the patient questions, find out if there are any changes, any updates. We do some vital signs checks on our own. And then, of course, we'll ask ourselves questions. Sometimes the consultant can spend 1 hour, even 30 minutes on one patient, especially if it's a chronic condition, a critical case where he or she actually wants the junior doctors to learn. So ward rounds are always very interesting. They are very tasking, mentally draining sometimes, but they're actually quite interesting because you get to learn a lot actually from the senior doctors, the senior registrars, the consultants. You actually get to learn from them. So we go from bed to bed, ward to ward. After that, after the rounds, then the clinic starts. So like I said, depending on the unit. So every unit has their clinic days, and even sometimes they even run clinics every day. So the clinic starts. So if you're working morning shift, you start the clinic. If you did night shift, then you can go home afterwards, after the rounds. So the clinic starts, and then we see on an average. Then I can remember, there was a time I saw only me, just me alone. I saw close to 100 patients. So, and that's like an average. So on average, a doctor can see close to from 40 to like 100 patients every day. That is already a lot. Clinic days, it is sometimes so chaotic, so crazy. And that's why most times when I get to speak with patients and then they are complaining, oh, the doctor did not explain. especially in Nigeria, I used to tell patients that sometimes you may have to ask questions. Sometimes you have to give that doctor a little bit of room. Well, because I just mentioned, imagine seeing 100 people in a day for a very short number of hours. Trust me, you don't have time to even remember some questions you're going to ask. And you may not even have time to even spend, because you're supposed to spend a good number of time with each patient. You may not even have that time. So if you go to the hospital and you're spending 6 hours, please, I always tell people, just be patient, because sometimes we have to ask clerk, that's what we call it, called clerking. We have to ask certain questions to get the right information so that you will not be giving wrong diagnosis and giving wrong medications and treatment. But in the Nigerian setting, that was one shock I received, the fact that I have to see close to 100, on the average, 100 patients every single day. That's why there are a lot of burnouts and brain drain right now, ongoing right now in Nigeria. We'll talk about that in our other videos. So after the clinic, if you're scheduled to just be working the morning shift, most time clinic days can end like 4, 5 p.m. depending on how busy the clinic is. And then you get to go home. So that's the morning round. Or sometimes where you're needed to also do like a general round on your own, especially junior doctors, just to check on the patients being admitted into the ward, the ones that you admitted maybe during the clinic, or the ones that were already admitted previously or previous days. You check on them before you call it a day. Now the person doing night shift resumes. Most times, typically in a Nigerian hospital, especially government hospitals, night shift, or even private hospitals actually, night shift starts 4 p.m. So you're expected to come in 4 p.m. So when you come in 4 p.m., we actually do have a doctor's quarters, like a doctor's room. We call it call room, where you have to, stay in for when you're needed or when you're called in to attend to a patient in the middle of the night. So 4 p.m., you come in, you clock in. The first thing you have to do is do your own rounds, because you have to first of all find out if there are new patients that have been admitted. And in a Nigerian hospital, most times doctors don't do handovers. Now, sometimes it depends. Sometimes the doctor might want to do handover if the case is very peculiar and you're needed to really pay close attention to that particular that particular patient. Sometimes it's the nurses that will do the handover for you. Again, depending on the peculiarity of the unit, the department, or even the hospital, actually. This is my experience working in Nigerian hospital. So they do the handover. You go through each bed, go through the case notes, go through every single thing. After you do your own personal ward round, you go and rest and prepare and hope that there is no emergency. For me, I have so many stories to tell about my experience working, especially when I was doing my house job. Because for the first time, not when I experienced death for the first time. I mean death, experiencing a patient dying in my arms for the first time. I'll share that story some other time. But it was especially you get to experience and learn a lot, or gain a lot of experience, especially during your night shift. Not really during the day, but especially during the night shift. Because night shift, you're mostly alone. So for emergencies, for whatever it is, you are called at any time of the day to wake up and go and attend to the patient. That's the reason why I think it was when I was doing my house job, I had a very terrible sleeping pattern, because they can call you at 2 a.m. and you might be awake from 2 a.m. till the next day. Sometimes you may not even sleep at all because of how busy the call is. So call for me was interesting, one, but it was also tasking mentally and physically and even emotionally, because there were a lot of times, trust me, I cried. A lot of times I cried. Like, not in front of the patient, of course, because we are told you cannot express emotion, which is a terrible thing, actually, for doctors. I think that's part of the reasons why a lot of doctors are committing suicide in Nigeria and even in the world, because we are told not to express emotion. But I feel like doctors, we see a lot, so I feel like we have that right to express some form of emotion. Maybe not in front of the patient, even with the patient, maybe show some form of empathy, But a lot of doctors don't really show any empathy now. which is terrible. But I tried as much as possible to really bond with my patient. And I have so many experiences, even experiences working in the pediatrics ward, where nursing a preterm child, a preterm unit, a preterm baby from 1 kg or 0.8 to them becoming 2.5, 2.8, even 3 kg. Even the ability to even see life, like a woman giving birth, it's an amazing experience that you really have to experience it for yourself. Another part of the things I love about medicine, the ability to bring life into this world, another life into this world, the ability to save life, the ability to preserve life. Those are part of the reasons why I studied medicine. And I think that was one of the things I really enjoyed working in the hospital and doing my clinical practice. It was really quite interesting. Now let's move on to working in emergency, a different ball game entirely. Because I'm sure some of you will be like, in some hospitals now, they put barricades in front of emergency. Why? Because patients used to beat us. Patients would threaten our lives. Patients would assault us. Patients will stab, and patients do a lot. So because of that reason, most hospitals now, especially government hospitals, because of the large patient base, they put barricades, what we call the protectors and all that, in front of the emergency entrance. So to avoid any form of assault, fight, or whatever towards the doctor. Because trust me, yes, I had my own fair share of experience of beating. And when I was working in the hospital then, during our calls in emergency, most times we don't wear our ward coats or even our scrubs. Most times we'll dress in muftis. Why? So that we can blend in with the patient, just in case one relative decided to say, you must save my relative today. The person must know that if not, you'll be next. You are the one I will shoot. You are the one I will kill. You are the one I will do this. You are the one I will do that. So we dress in muftis like the patient or patient related. So most times, so unless maybe I'm carrying the steps, you will know that I'm a doctor. If I'm not carrying the steps, you might think I'm just one regular, another patient or a relative. So working in emergency was also another eye opener in Nigeria, working in Nigerian healthcare system or even in Nigerian hospital, because you have to be at alert. You have to be ready to take up any challenge, any situation. You know, in case of working in a department or unit now, this is a situation where you are dealing with all sorts of cases as they come in. And in Nigerian hospitals, when the emergency come in, we have to go first to the car. When we get to the car, especially if they bring the patients in the car, or if they bring the patient and they're dragging them, most times you tend to see them outside. I'm going to tell you the reason why. I know a lot of people have asked, why do we see people in the car first? Why don't we bring them inside first? Why do we see them outside on the pavement, or on the roads, on the pavement or entrance of the emergency? I've mentioned one reason, assault and beating. Number two reason, again, typical to Nigerian healthcare system, they want to know if it's a case where they have to refer you out or tell you you can't take the case cannot be managed in this hospital, or it's a case where you have to pronounce the person dead. That's another reason. But one most important reason is for our own safety. Why? Because we are doing it, we are observing the patient in an open space, so that whatever happens, for one, and most times that's why we tell the relative not to crowd the doctor. Not because of anything, no, truly, so that somebody will not stab us because we've had experiences. I have had experiences like that where you're trying to pronounce a patient dead. So you go in, you see the person, you check all the vitals, the person is dead, for example. Most times I will not tell you the patient is dead or whatever it is at that particular time. Sometimes I would have to step out of that environment and then go out, maybe call one of the relatives and give them that information. Why? For confidentiality's sake. Number two, to protect yourself. And number three, so that you can easily deliver the message or the information in the right way. So these are the reasons why these things, again, I said, they are peculiar to Nigeria. It's not like that in every other part of the world. But because of the way we are in Nigeria, we can be very hyper. I don't want to call us violent, but this is what it is. That's the reason why we do that in the emergency ward. And that's the reason why we give such information. That's the reason why they're always treated outside. It's only when we say, okay, they are alive, because the case that we can manage, then we bring them in and admit them into the emergency ward or into the emergency room before we transfer into the ward, depending on the case. So that's the emergency department for you. Now, surgery department. That is surgery in a government hospital. I'm sure a lot of people will want to hear this. Why? Because you'll be wondering, I don't know about now, but even up to last year or so, you really have to book certain surgeries ahead. We have a surgery book. I'm sure a lot of people don't know this, that in surgery, we have something we call surgery book, where if you're scheduled for a surgery, we have to write your name and every other of your information in that surgery book, especially in government hospitals. Let's say it's a surgery, it's an elective surgery. So that's how they will tell you, come back in 1 month's time. It's not because of the fact that, maybe this surgery might not be available. Most times that's not the reason. It's the reason because we already have surgeries scheduled for 1 month and there is no space to fix you. I mean, almost every day or every surgery day for that week, for the period of 1 month, sometimes even 2 months, before it will get to your turn. So that's the reason why most people rather go to private hospitals. And because why? There's no, the crowd is less, the scheduling is less, even though now, because of the number of people that are falling sick and require medical help from private hospitals now, you still have to book. They might still even give you 1 month. Aside from that, also the fact that we have very few doctors in Nigeria. Another gist for another episode. We have very few doctors in Nigeria now, so your surgery has to be scheduled. Even emergency surgeries nowadays, sometimes it's not even emergencies. And these are the challenges that we are facing currently, especially in the Nigerian healthcare system. We don't have enough surgeons, we don't have enough doctors to take these surgeries. And we have a lot of people that either wait till when they are in their need of surgery, or they either wait till when they are financially buoyant actually to do the surgeries. Those are the factors actually. So when you have question that, they booked me for 2 months, this is the reason they booked you for 2 months, or you're scheduled for 3 months or 1 month, that is the reason. It's not because the surgeon is not around. Most of the time it's because we have a lot of surgeries scheduled for that period and you cannot be fitting into it. So anytime we fit someone into a particular booked or tight schedule is if it's an emergency or it's life threatening or it's death and life. But that's the whole summary actually of each of these departments. They have their peculiarities, they have their challenges, they have their own uniqueness. But that's the general overview. But if you have any questions actually regarding each of the departments, or you have any question regarding the clinical life or medical doctor or practicing medicine in Nigeria, you can always put them in the comments. And also, if you're a medical doctor watching this, I would like to hear from you, like your own experience working even as a house officer, where you even did your own house job, even working in a government hospital. What department were you in? What was your experience actually? Do you have the same experience with me? If you're also a medical doctor that's schooled outside of Nigeria, for example, like me, and moved to Nigeria, what's your experience? You can share that with me too in the comment section. And trust me, I would like to hear from you. I would really talk about it and definitely share that experience together.